Hello everyone, I'm Dr. Azam, academic head, consultant anesthesiologist and critical care specialist at Bhagwan Mahavir Jain Hospital. Let's talk about permissive hypotension, a concept that every anesthesiologist should master, especially in cases of trauma. As anesthesiologists, we are often at the helm of hemodynamic management, whether it is trauma, ruptured aneurysm, or a penetrating injury or obstetric hemorrhage. And in such scenarios, understanding when and how to allow controlled hypotension can critically be life saving. Let us look at the key goals. So, what are our key goals? And when we talk about permissive hypotension, number one, we want to maintain a vital organ perfusion, especially to the brain and the heart. The second, we aim to prevent worsening of bleeding. If your blood pressure is too high, it can dislodge, forming clot and causes rebleeding. And the third, we want to reduce the need for massive fluid resuscitation because too much of fluid can actually worsen the outcome by promoting coagulopathy, acidosis, and hypothermia, what we call as lethal triad. So, what are the targeted blood pressure values? Now, let's talk about the numbers. Our target for systolic blood pressure is usually between 80 to 90 millimeters of mercury, and for MAP, we are looking around anywhere between 50 and 65 millimeters of mercury. But there is an important exception for this. In traumatic brain injury, we aim for a higher mean arterial pressure values, ideally above 70 to 80 mmHg to ensure adequate cerebral perfusion pressures or the CPP. Permissive hypotension can be very useful. There are situations where it should be strictly avoided. Number one, traumatic brain injury, because lower blood pressure can lead to cerebral ischemia, as I said, can further lead to decrease in cerebral perfusion pressure or CPP. Second, spinal cord injuries. Again, perfusion is very critical. The third, pregnancy. You need to maintain adequate uteroplacental perfusion. And finally, patients with severe cardiac diseases, they simply cannot tolerate the drop in pressure. So that's a quick overview of permissive hypotension. When to use it, when to avoid it, and what targets to aim for. If you want to learn how it is done in real world scenario, stay tuned for our upcoming clinical sessions. Thank you so much, and as always, happy learning.